Ladies and gents, welcome back. I'm happy to be bringing a heartwarming story this morning about Canadians rallying together to save a life that was left behind by a provincial government and our failing healthcare service here in Canada, or not so much anymore universal healthcare service. And we'll get into that part, but let's talk about the heartwarming part first. This story is about Sheila Annette Lewis, grandmother in Alberta, Canada, who was denied service, denied a transplant, a life-saving procedure in the case because she had refused a COVID-19 vaccine. They brought this policy in as she was at the top of the donor list, or she was at the top of the recipient list, but she was removed from the list because she had refused this COVID-19 vaccine. Now, I covered this last week, and ever since that coverage and other news outlets picking this story up and people sharing this all over social media, she's raised $71,000 of the, actually almost 72 now, of the initial $100,000 that was being raised for her initial tests to go down to the United States and be served by their medical system, which is ridiculously expensive, but still available to people who, celebrate bodily autonomy in this world here as we're at. Now, I'm going to talk about the recent update here. So there's an update as of this morning. Hello all. We wanted to begin by thanking you all for the amazing efforts to share Sheila's story and for donating generously, which has resulted in our pool topping $70,000 as of today. We read every message and appreciate every prayer. We feel confident now that we'll raise the remaining $30,000 we need to pay for Sheila's testing, which Sheila will be given a date for in the next few days after the testing. She will hopefully proceed to be placed on the recipient list, at which time she will be given the exact total we will need to raise for the transplant, which again will be upwards of $500,000. This is really what's going on here. Canadian citizen having to leave the country because of refusal to be given life-saving medical service, having to spend $500,000 in the United States. But thankfully, so many Canadians are rallying behind this and sharing whatever they have to give in order to save a life here. And to that end, Sheila continues to do as many interviews as she is able to do. There are two of the most recent with Sydney Fuzzard of the Rebel News and Jeff Coor of Ringside Politics, and in New Orleans. Please watch, share, and continue to spread Sheila's story widely. God bless you all, says the post here. Now, Sheila, if you're unfamiliar with the story, and again, I'll leave a link in the description down below where you can watch the first video that I did last week, but the Supreme Court won't hear the case of dying unvaccinated woman requiring an organ transplant. Now, it went all the way up to the Alberta Supreme Court, and the Supreme Court of Canada, and they will not even hear the case. It's not that they've listened to the merits of the case. It's not that this has gone through this way and they've denied her there. No, they just refused to even listen to the case. Sheila Annette Lewis is dying of a terminal illness. She was removed from the top of the organ donor transplant list after refusing to be vaccinated against COVID-19. Now, the Justice Center for Constitutional Freedoms is representing her in her fight. Annette Lewis versus Alberta Health Services, ABC Hospital, doctors who cannot be named because of publication bans here. The Justice Center represents Sheila Annette Lewis, who has idiopathic pulmonary fibrosis, a terminal condition. She brought an application to the Alberta Court of Queen's Bench asking that her court uphold her charter-protected right to conscience, bodily autonomy, and freedom to choose without coercion. So again, she's being forced into this COVID-19 vaccine, of which subsequently she actually had testing done to make sure that she had antibodies for COVID-19, to which she passed with flying colors. She has antibodies for this. So they're just being stubborn on this issue, saying that she needs to take a vaccine that, showing that she has antibodies for the COVID-19. You would assume that she does not need, but they were pushing this nonetheless. Now, the case is under a publication ban due to a court order. The Justice Center may not reveal the names of the doctors, the hospital, the city where the transplant program is located, nor the name of the organ that Miss Lewis needs for her life-saving surgery. The transplant program team is a group of doctors who work within the organ transplant program, which is funded by Alberta Health Services. Both the transplant program and AHS have unwritten policies which require transplant candidates to receive the COVID-19 vaccine prior to receiving their transplant. So these are not written policies. These are just unwritten ideas that they've just come up with, and they're arbitrarily withholding life-saving services. Now, it's argued that healthcare is a right in Canada, and if it's a right, well, how can they take it away from somebody for not doing something that's not even a written protocol? It's not even a written obligation, but this is an unwritten policy of these particular doctors, and no court wants to even rule on this. And well, the whole idea is that the courts don't want to set a precedent because, well, then many more people would be challenging this in the courts, is my assumption here. Neither the treating physicians nor AHS COVID vaccine policies for the transplant patients are written, but both were communicated to Ms. Lewis by her treating physicians. While the circumstances around the policy were debated, Justice Center lawyer Alison Pajovic notes that the evidence was clear that AHS and treating doctors either made the policies, were aware of the policies, or enforced the policies. So this is really on them, and they can't blow this off and tell you that it's some other person who's responsible for the refusal of this health-saving procedure for this lovely grandmother here in Canada. But now I'll leave the links in the description down below so you can check these out for yourself. But I wanted to really just share the heartwarming part of this whole story, and that's the fact that Canadians have rallied around a person once again to save a life and are continuing to do so. I've been monitoring this over the past few days, and it's just growing exponentially. The number just keeps growing. Again, it broke $70,000 this morning, and as the time of recording this video, it's already up to almost $72,000 at this point. And of course, this was, again, the initial $100,000 to get the testing done in the United States. Testing that, again, could be done here freely, but has been refused by our public service. This is a very dangerous precedent in this case where life-saving procedures can be denied based on some other arbitrary rules. And we should really make efforts to walk this back. And perhaps Canadians rallying around with their own money is a good indication that there is really lots of support for this moving forward. And hopefully we might get some recognition from the provincial premier. That would be Danielle Smith, who has refused to step in this case and put any political pressure on them. There's been cases recently where Smith, just with the idea of possibly giving political pressure to any of the any institutions in the province, has created a political backlash against her, and I see that she's wanting to stay away from that. But I think this one really goes beyond the pale, and I think it really deserves the political pressure that is needed. And, if this woman could get her procedure done here in Canada and not have to go to the United States, well, maybe that money could get put to another good use. But nonetheless, this is, again, another good heartwarming story for Canadians coming together to save a life. But anyway, leave a comment in the comment section down below. Let me know what you think of this whole thing. I'm going to keep following this one closely. Hopefully, maybe even get in touch with Sheila Annette Lewis to come on the channel if she's feeling energetic enough and talk about her own story for herself. Anyway, leave a comment in the comment section down below. Let me know what you think, and we'll see you in the next one. Keep on trucking.